Good.
Okay.
Gentlemen,
To call the Health and Human Services Committee meeting to order. I'll entertain a motion to approve the November 10th minutes.
Lydia.
Second, thank you. We started with 4 resolutions, but I think we have 6 resolutions on the agenda tonight. 1 from the Health Department, 2 from Mental Health, 2 from Office for the Aging, and 1 from our Youth Bureau. So I guess we can, I know Kathleen is on video, and her 1 resolution, HH1, is to authorize the chair of the legislature and the public health director to renew a contract between Finger Lakes Dog Protection Agency and Cayuga County. This is you've had this contract in force for a number of years. My understanding is this contract reflects a 3% increase. There had not been any increase over the last 10 years. And this is the work that is done by Finger Lakes Protection, and it's outlined how it's reimbursed in the resolution. There's an on-call rate, specimen preparation, euthanasia, confinement of the animal, and then there's mileage paid at the IRS standard rate. And is there anything you want to add to that resolution, Kathleen?
I don't know that we need to add anything additional, except that we do have grant funds to cover rabies control that is used for this purpose, but also for rabies treatment. And anything that does not fall when we exceed our rabies grant, state aid picks up a percentage of this work as well.
The 36% of the work
Yeah,
under animal
not,
control.
right. If it's not eventually at least 36%, it may be more.
Yes. Okay.
Move it, Lydia.
Nightingale, second.
Okay, any questions, additional questions on this resolution? Okay, all in favor?
Aye.
Aye. Okay. If you want to give a very short report, Kathleen, that would be great, and then we'll move on.
Sure. My very short report will be to say that I wrote down all the highlights and they are there. I look forward to sharing the community health assessment and health improvement plan with people when it's available. Please spread the word about lead poisoning prevention, home assessments for anyone within the county. And also for those areas qualifying, we'd like to encourage people to take part in our Healthy Neighborhoods program. It operates year round. Right now it's upon appointment. We're not necessarily going door to door with like we do in the warmer weather. And if anyone has any questions, I'll be happy to answer them.
Any questions for Kathleen?
Madam Chairman.
Lydia has one.
Hi, Kathleen. Thanks for being here tonight. My question is, inviting somebody from a Department of Health could be a little nerve-wracking when asking them to come into their home, concerns about fines or other repercussions. What can we?
The sound just blipped out, Lydia. I don't know if you can all hear me. I cannot hear anything from the chambers right now. If you can hear me, definitely we'll work together, because we like to look at the health department as the friendly, one of the friendly agencies who are there only to offer support. This is absolutely voluntary, and we certainly want people to know that any of our staff will be well identified as health department staff. They should ask for identification of such. And if we are accompanied by other agencies, for example, in the city fire department will often accompany us. They will be well identified as well. And if anyone ever did have a question, we encourage them to call the agencies that they are representing so that we can verify that for them.
Heidi?
Kathleen, are you also still using or able to use the young sort of college age interns for the healthy communities?
We're not right now. We don't have, typically it's summertime, but sometimes it's throughout the year that we have interns. Although I do anticipate that may be something we'll look to develop again further. Right now, we do have some public health fellows that are able to help. We partner with the Cayuga Community Health Network, which is providing support as well as health department designated staff. And again, the volunteer fire departments and some other agencies provide support this way. But we try to, I anticipate we may be expanding that as time goes on.
Okay, one more question, if I may. In the city of Auburn, is all of Auburn included in this grant year or just sections?
What's really nice is it's the entire city right now. You are correct, recalling back at one point in time when we had this grant, it was certain neighborhoods, but right now it's anyone within the city borders, and then anyone within the town of Montezuma are able to participate.
Okay,
And we're
thank you.
glad to talk with people also. To Lydia's point, and I'm sorry the sound had broken out. If you have any ideas that can help us in getting the word out in a friendly manner so that people know this is a completely voluntary, only there to be able to help with air quality, fire prevention, injury prevention. We want to be absolutely non-threatening. This is a completely voluntary program that's only meant to help educate and provide some
Have you done public awareness of the program, Kathleen? Have you put?
We're doing some, but I think we can do more, and that will be something I expect will expand more as well. Now that we have identified some people who will work in that program.
Madam Chair. Thank you very much, Kathleen. I really do appreciate it. And especially that you mentioned town of Benson, town of Montezuma. I will be bringing this information into the meetings with me this month and strongly encouraging them to not only reach out and talk to you at the number or by email or on site, but I will also offer up my contact information as well so that we can encourage them to use this. You know that lead poisoning is high in my community, and you are very helpful in educating our folks about that. So thank you for all that you're doing for our community.
Yes, you're welcome. Thank you.
Okay, anything else for Kathleen? All right, if we want to move on, we can go to the mental health resolutions. There are two authorizing the mental health department to enter in and the county to enter into a contract with Upstate Medical University Department of Psychiatry, and that's to cover an additional psychiatrist.
Yeah, so that would only be as needed for the 7:30 competency examinations. So if two psychiatrists do the examination and they disagree, there would be a need for a third psychiatrist. And at the clinic, we do not have a third psychiatrist, so this would be the contract out to provide that evaluation.
Do you
Or
see
as
that
needed.
happening often?
I mean, we've had significant number of 7:30s.
Yeah.
I don't know how often we would be using the contracted psychiatrists versus the ones that we have. It would basically be on an as needed basis.
It sounds like they're locking in the rate for 5 years. It's a 5-year contract. But
Yeah, but the rate can change from year to year, but we would obviously, they can submit a budget every year as far as what they would do. And it only changes based on the psychiatrist and how, if they're board certified or double board certified.
Right,
or
there's a
whatever.
range. but I
Yes,
mean,
there's a range, yes, yeah.
Can I get a motion for HH2 in a second? And then there's other discussion if we want to.
Nightingale, move it.
Second.
Thank you. Okay, any questions on this?
Elaine, I just got one.
Yep.
Is this doctor on retainer or is it by the hour when you use them?
It would be by the hour, yes.
Okay, so if we don't need them, cost nothing.
Correct. It would only be, if we were asking them to do the evaluation, that
Physically,
we'd pay,
yeah.
yeah.
Thank you.
Yep, sure.
How do we budget that?
So that's in the professional services budget line.
That's where the funds come from for that.
The questions?
I have a question.
Yep.
It's sort of related, not related. There's so much development in this area in our hospital in coordinating with Upstate now. And I noticed that this is, coordinating with Upstate. Would you find that there'd be a local Auburn hospital base, but through Upstate here in Auburn, or would it probably be out of the city?
It would be out of the city just because they have a specific forensic psychiatry unit, which would be specific for these types of evaluations.
There's no local resource other than,
Right.
Just curious because there's been great expansions at the hospital lately that include connections with upstate.
Right.
Thank you.
Okay, so we have a motion and a second. Any other questions? All in favor?
Aye.
Aye. Okay,
Thanks,
we want to
Lynn.
go on to HH5, which is
Let's go.
the contracts with various agencies using your mental health state aid that comes to the county.
Correct. So these are all contract renewals. We've actually had contracts with all these agencies up until now, just that the contracts are up. So we would want to renew those contracts with all those agencies. And that state aid that comes to through mental health from OASIS, which is Office of, Substance Use, as well as developmental disabilities, and then go to the agencies in the community based on sort of services that we contract with them for.
So it's the 3 disability groups that are able to be served by this state
Correct. And
aid.
it flows differently. There's a certain amount that comes from each state agency, and then that's distributed to the agencies based on services that we need in the community.
Can I get a motion?
Move it.
Second? I'll second it. Yeah, and we were having some conversation about this. Some of these funds are going to these particular agencies in these amounts for this year. And you also have funds that come into the county mental health clinic.
Correct.
Or
And that
department.
isn't all the agencies. I will be coming back with another resolution. I just haven't sorted out the numbers for some of the other contracts we have for
Oh.
state aid. So it's not all of the state aid
Okay.
in that one resolution, but that is majority of them.
But there may be others or changes. and
Yep, there can be
cleanups.
changes each year or during the year of state aid funding moving from.
These are the
agency.
ones for sure that are going to be covered by the 2023 state aid.
Correct.
And there is more.
And they're providing services at this point already. We're just renewing the contracts. The only one that is different is the Grace House. They received additional funding this year because the regulations changed. So that money it's reflected in the resolution of the amount of state aid that they're going to be getting for next year.
That's the Unity House increase. Yep.
Yes.
Yeah, just to be clear, these are the 5-year budgets for these contracts?
So
Or the 2023 budget?
that's the 2023 budget and how it was written in their previous 5-year contracts, which obviously
Right.
have questions about. It specifically states that they will submit a budget every year and that all payments are under this agreement are conditional upon the state aid funding. That's how it was always written prior for the 5-year. I went back and looked specifically because I know you had a question about that too.
Okay, so for years 2, 3, 4, and 5, where you're going to manage that is through the budget process as opposed to the contract process.
And a lot of that is, it will automatically increase unless we specifically change it based on COLA and other things as far as the state sends, the state aid funding to us, the amount.
And, again, the fact that we have a director of community services and a community services board and a local governmental unit. That
They are
is the
responsible.
reason why that we get this state aid, and the community services board is responsible to oversee the services to the 3 disability groups.
In the
And
county.
you make these awards based on meeting those needs, correct?
Yes, correct.
So Rich had the same question that I did,
Right.
and I just wanted to, for my own edification, and you just did it, reinforce that the Community Services Board is on board with making these decisions about where money is going and what the.
Anytime there's a
objectives are.
change in movement of state aid, it's discussed with the community services board before any of that happens.
Laying behind you.
Sorry.
So the community services board, is that a board that's funded by the county or?
It's a
what is it?
voluntary board.
It's a voluntary
Yeah.
board.
I sit
I love them.
on the CSB. There is bylaws, and I think Rich did the training on it. It is vetted in mental hygiene law that we must have one.
Right, and we're required to have a community services board. They're appointed by the Board of Legislators. It's the vehicle by which, as Elaine mentioned, that the state aid comes to the local governments. And it's a bit of an anomaly because it's not a department. We have a mental health department. We're all county employees. The Community Services Board is an oversight advisory board, if you will, that's appointed by the Board of Legislators, but under the mental hygiene law, they have legal functions such as the appointment of Director of Community Services. Thank you.
Yep. Right. There was a big debate when Ray left, whether or not we would separate those positions and have a clinic director, a mental health clinic director, and a separate DCS. But most smaller counties who have a mental health clinic have embedded those two roles under one. But the
Right,
the
so this
community
would
ser-
be a specific role of the Director of
Yeah,
Community Services.
right, the
Along
CS,
with the Community Services.
yes, and the CSB hires, fires the Director of Community Service, and the county appropriates the salary for it. So it couldn't get more confusing.
Yeah.
Oh, it's clear as mud. Thank
Yeah,
you.
it couldn't get more
How
confusing.
many people are on the board?
Pretty bureaucratic.
How many people are on the board?
I'm going for people that would.
I was gonna say 13.
It's a larger board. I think there's it's over 10 people. I don't, it's an
That's-
odd number, I know that, but I don't know specifically.
Tens and even.
You might see like the appointments come through HHS and then to
Okay,
to the floor.
all right. Interesting. I'm glad I came.
And don't you have some requirements that you should represent some of the consumers and some of the disability groups and have expertise?
Yes.
In
So
some
like
of
a
them.
There's all different criteria of what you should have included on that board, like your one physician.
Yeah, Dr. Duckett is a current board member of the CSB.
Yeah.
Brian Shank
Yeah,
is on the CSB.
she said there's more.
And part of their responsibilities is to, by statute, they are to develop the plan for how mental health services are provided to the community. And that goes to what Elaine just said. You have constituents from various components to address those needs within the community. And then they ultimately develop the plan and how those resources are going to be distributed within.
And it's this community services board who's going to be looking at the proposals for the use of the opioid money because they have a subcommittee, alcohol and substance abuse. So there has been a lot of needs identified and moved up. You just put the application out. And in order to get any of the opioid money to address the substance use needs of people in this community, it has to identify an unmet need and it has to fit within those criteria.
Yeah, those applications are actually, I was gonna say that in my update.
Okay,
but Those are
okay.
due on December 9th, and then the Community Services Board meets the following week, so we'll start to review those applications, proposals to see what we're gonna fund and what we feel like is needed in the community.
Great.
Thank you.
One
Sorry.
question, go back to the budget issue here.
Okay.
So if in any future year, the state does not provide state aid, these folks
Right.
will get nothing.
Will
But
not
then
get funded.
how do you decide which one? Let's say there is a budget shortfall and, the world comes to an end and Albany says we don't have any money for this. How do you pick and choose which agency?
So that happens now with the amount of state aid funding that we have now. And the Community Services Board is the way that we discuss state aid and what the recommendations are for that funding to go for a variety of reasons. Sometimes state aid has already been taken or moved from agencies and moved to other agencies. So that happens already. So we would do that for the board as well and have those discussions.
Other questions on HH5? Right, all in favor?
Aye.
And
So that was one of my updates, was about the opioid settlement funds.
Okay.
Also, we have one applicant for a social worker, possibly two. So I'm crossing my
Oh.
fingers that hopefully we can
Get
get
the
somebody in the
crisis.
position so that, beginning of next year, we'll be able to start the mobile crisis daytime program. So we'll
Right.
see.
fingers
I'm
crossed.
hopeful. And then just another thing is, we received a workforce grant through OMH for this year. And they just notified us that will be something that will roll over into, we can roll that money over into next year. So I'll be doing a budget
Any
adjustment for that.
unspent money, like the
Yeah.
66,000 can roll?
Can roll over till next year. So we've been we did a staff retreat. I know I mentioned that to you here before. It went really well. There was a lot of positive feedback. I think it really helps morale with our existing staff and retaining them. And we've really invested in a lot of training for next year. So the hope is we'll be able to continue to do that with the money as it rolls over, and maybe do another retreat next year with that money. So I just wanted to say,
Yeah, Lynn, is the money gonna roll over that was unspent from this year? Don't try to pretend you're not here.
we received notice from.
I am here. I had to unmute myself. Yes, the funds were actually set aside in a deferred revenue account. So we have them all set aside. So that won't be a problem to go into the next year.
Great, thanks. You might not have to do a resolution. Oh, you might have for a contract or whatever you're gonna spend it on.
Yeah, or,
right.
yeah, I just wanted to mention that
Yep.
that's sort of what we're investing that money into, is to train our staff in some things that they were interested in doing. I think that helps also keep our staff, existing staff there, so.
Great.
Hopefully we can hire for that new position and start that new program.
Yes, great.
That's it.
Okay,
Thanks, Lynn.
Thank you.
okay, we are down to OFA, not down to, but officer aging. We can, you have HH3, and that's your signing of the subcontracts with the various agencies using the 2023, these are all in the 2023 budget. Okay,
Yeah, this is our annual update to all our contracts.
and if I'll group together both of them and then we can ask Brenda. And then you have HH6, which I did advise the committee was going to be coming late because just the other day, yesterday, you received another resignation, an aging services specialist. You were sort of hitting the panic button that you would be down 3 staff, and you asked if we could move this forward this month, so you wouldn't have to wait a month and a half before we move forward.
Right, thank you. Yeah.
So HH5 is to authorize the contracts that she has with the various agencies that are in the 2023 budget. And HH6 is allowing Brenda to fill an aging services specialist based on a vacancy that the person will be leaving, I think that you told me the 20th of December.
Correct.
Lydia.
Move to bundle. Is that a move to bundle?
Yep.
5 and 6.
Okay, sure.
3 and 6 on mine, just before you.
Well, 3 is, oh, I'm sorry, you're right. It's 3 and 6.
Okay.
Yep, you're right. Thank you. Okay, we have any other questions about HH3 and HH6, these two resolutions? Okay, all in favor?
Hi.
Aye.
Great.
Enthusiasm in this group is really starting.
Yeah. Okay. Okay, last, we have one resolution from the Youth Bureau. Debbie, you want to come up and we were.
Is this your first?
Yes,
resolution?
this is her
This
first
resolution.
And if you can remember, Lloyd, in October last year, and these were contracts that started in January.
January 1st of 2022 will expire December 31st of 2022. So we're just getting the approval for the funding now from the state. So I'm proposing that goes into one of the programs for 2022 and get those vouchers.
Thanks, I'll move it.
Lydia second.
Okay. All in favor?
Aye.
Aye. Any opposed? Do you have any?
Questions?
Do you have a well, these are all the OCFS money. These agencies have been providing services since January with no payment. So, and you did say that they were absolutely going to try to get the funding out in a different timing, so that
Yes,
this
they're going to
doesn't
be-
happen again.
Yep, they're going to be, so the 2023 allocations are in. They haven't shared those with me yet because they are going to be into more of a state fiscal year, so we would get the funding differently. So for 2023, we're going to get 75% of what we normally get, but then for 2024, they're going to retro that 25% we're missing, plus another 100% for 2024 to get us kind of back on year where hopefully we'll get the funding sooner. All the agencies have been very understanding and they're aware and set up.
We had talked with Deb about the fact that these contracts have been in place and renewed year after year for a number of years.
Mhm.
And you are going to take the opportunity to look at the performance on these contracts and actually go see
Yep.
the programs in motion
Yep,
before they
absolutely.
end.
Yep.
because you'll have decisions to make about what to fund next
Mhm.
year or what to recommend for funding.
Absolutely.
Did we vote? Yeah, oh, we did. Okay, but do you have anything you want to say? Quick, because Dave's tired.
Oh, no, I had a great meeting before this. I'm just really looking forward to just doing different things with the youth bureau. It's been wonderful so far. Just looking forward to wrapping up 2022 and getting on to some new things in 2023.
Thank you, Brenda.
Thank you.
Thank you. Christine, do you want to talk? You don't have a resolution tonight?
I don't, that's my Christmas gift.
Thank you. Really. Gives you an ornament.
Next year I'll probably have a dozen. So
You get an ornament too?
Oh.
No, all right.
I'm here to answer any questions if anyone has any, and I also just want to say thank you for all of your support this year. I know some of you had come on board with me at the beginning of the year when I started my first year of appointment, and I just want to say thanks for your support and your help, especially to Elaine, in this past year with getting started on my own, and just want to say thank you for that.
You've done a great job.
Thank you.
Yeah,
Yes, thank you have.
outstanding.
Thank you for everything.
Yes,
Thank
you. Christine? All right, if not, thank you. Thanks. I'll entertain a motion to adjourn.
I think we should stay a while.
All right.
I can't even vote on it.